The best data comes from the original Diabetes Prevention Programme study. This randomized approximately 1,000 patients to each of three groups. One receiving standard care, leaflets, advice, and nothing more. One receiving metformin at doses typically used in type 2 diabetes, and a third group allocated to intensive lifestyle intervention, which included a 400 calorie per day cut in intake and a structured program of exercise of at least 30 minutes of aerobic exercise per day. When you looked at the effects of that study over a number of years on weight, they were pretty spectacular. In those allocated to intensive lifestyle therapy, they initially lost 7 kilograms and managed to maintain half of that weight loss out to 4 years. This kind of profile is absolutely typical for weight intervention studies. In contrast, the placebo group did virtually nothing. However, that's not as bad as it may sound, because generally people will put on 1 to 2 kilograms a year over a period of about 4 years. So here we have actually got cessation of progression just with standard lifestyle and people being in a trial. The metformin arm was somewhere in the middle with about a 3 kilo weight loss at 1 year, dropping down to about 1.5 at 4 years. So what did this mean in terms of the outcomes, which was new diabetes? This was very straightforward. In the placebo group, you had a 10% conversion rate per year from people who were essentially pre-diabetes to diabetes. This was reduced by about 2/3 in the intensive lifestyle group and approximately 1/3 in the metformin group. And these studies have now been carried on to 10 years and the benefits are maintained. Similarly, this has been done in other populations. It's been done in Finns, it's been done in Indian Asians, it's been done in Chinese, and all the studies come up with the same data. Intensive lifestyle therapy is very successful in making people lose weight and very successful in reducing progression to type 2 diabetes. If you look at the data within the groups, one can quantify the quartile of baseline diabetes risk in each of the groups, and as you'd expect, there's a gradation across the groups, which even in the placebo group ranges from 10% in the lowest risk group to 60% progressing to type 2 diabetes in 4 years in the most high-risk group. The results with lifestyle are a shift of the whole curve, both down and across. So there is benefit right across the quartiles of risk. So lifestyle has dramatic effects. However, in the metformin group, you don't see very much benefit in the lowest 2 quartiles of baseline risk, but you do see more significant benefits higher up the scale, which is probably indicating a greater predisposition and a greater degree of metabolic abnormality. And this would fit with the predictors, which are the age, higher triglycerides, higher glucose, and adherence pretty much drive the whole progression over the study. But in the metformin group, you also have factors such as a family predisposition to diabetes. That's what gestational diabetes represents in this case. And probably in prior metabolic syndrome, factors related to systolic blood pressure also coming out.